Most of this we learned from our own experience growing up in our families, how our parents, grandparents, other family members, or friends lived their lives. Not everyone had that advantage, though. The base of our society, family care, as we are on call with the Prairie Doc.
Good evening and welcome to On Call with the Prairie Doc. The definition of family is a bit of a moving target. You often hear members of sports teams talk about their fellow players and coaches as family. Here at On Call with the Prairie Doc, our production staff and studio crew are a bit of a family with the ups and downs associated with closeness of our work environment. On a grander scale is the family of humankind. All of us, we're in it together. But at its core, the group most thought of when we say family are the people we're related to, mom, dad, sisters, brothers, and maybe a few select cousins thrown in there as well. The family unit is a basic building block of human society, and its care and nurturing is important to a healthy life for us all. Tonight we're joined by two men who practice family medicine, Andrew Ellsworth and Jeremy Beireis of the Avera Medical Group and the Brookings Health System right here in Brookings. Thank you both for joining us.
You're welcome. Good to be here.
This is going to be sort of one of those Ask Anything shows. So now think about it. We're going to be answering any questions. I challenge you. So tell us a little bit. Let's see, you've been here for a little longer than Andrew. Tell us about yourself, Jeremy. Where are you from?
I'm from North Dakota originally. Grew up about 20 miles west of Grand Forks, a town called Arvilla.
In town. You're a townie?
We are kind of a mile out of the town.
Oh.
Town of 300.
Yeah, it's
so pretty small.
Pretty small.
Went to medical school at the University of North Dakota, did undergrad there, lived in Sioux City doing residency for 3 years, and I've been here since. 5.5 years.
So what drew you to Brookings?
You know, I think it was in the middle of Grand Forks and where I did residency. My wife's from Sioux City. We weren't married at the time, but that was kind of I knew it was going to be in the middle, and interviewed here, had a great group of doctors, and enjoyed my interview and some follow-up stuff.
Yeah, good. And tell us about yourself, Andrew. Where are you from?
I'm from Madison, South Dakota. And
how many people in Madison?
About 7,000.
A little bit more than 300
right.
or 400. I mean.
Right. And went to Augustana for undergrad in Sioux
Falls. And your dad is a mortician.
He is. Yes, he'll love that you brought.
Yeah, I brought that up.
Yeah, Bob Ellsworth in
yes.
Madison, South Dakota.
He's a pretty famous guy.
Yeah.
So let's see. We stab him, you slab him, or what is that joke? There's a bad joke. Never mind. I'm sorry.
So I went to Augie for undergrad, and then USD for medical school down in Vermilion, and then went out to Boise, Idaho for residency in family medicine. And then my wife is from Laverne, Minnesota, and we wanted to get back to the area, and we decided Brookings was a great place to live and raise a family, and great partners.
Yeah, so good people to work with.
Yep.
And if you're from Laverne, do you say Laverne? Is it a Laverne, Minnesota?
I think it's Laverne.
Laverne. A lot of R there.
Yeah. Yeah, Minnesota.
Minnesota,
Yeah,
Laverne, Minnesota. We're from this area. So family practice is what you both went into. I mean, and now, do you, either one of you do OB?
I am doing OB.
So you do OB.
I used to do OB, and I don't anymore.
All right.
And so that means I'm delivering babies.
Right.
Because that made...
Obstetrics.
Right.
So you're an everything there is to do kind of a doctor. The old type of guy. You don't go to the households and don't ride a buggy out to the farm yet, but almost that.
Yeah, yeah. I really am loving what I do. I love how I can, you know, even just today, I have a baby in the morning, and in the afternoon I'm going to the nursing home and rounding, and
From birth to death.
From birth to death, and that's why I'm a family doc. I love taking care of families. I love the dynamics. I love how that can help me take better care of people, I feel, by knowing their background, knowing their values, and taking care of the family.
So what's your take on that? I mean, you decided not to do OB because?
I just felt I wasn't busy enough doing OB. We had a couple new female providers come in. I found the number of deliveries I went down, and it was I just wasn't comfortable at a certain point.
So there's a time when you
Yeah.
feel, well, let's spend a little bit more time with this concentrated.
Yeah, and I kind of got to that point. And
well, I have to say, and I'll say it to you, I'm a general internist, which doesn't do OB, and we don't do peds like you guys do. But we do adult medicine. Probably my practice is geriatrics. And the three of us really constitute general practice. We take care of everything. And so it begs itself to say, come on, we're focused on family care today, but it's a broad enough subject that you should feel free to ask us about anything. And this is an Ask Anything kind of a program. Screening exams, common childhood illnesses, diabetes, all those things that affect your family, so that lines are open to whatever your questions take us. And as usual, we answer your questions as they are called in, so you want to hit it up soon. There will be questions that we'll have time to answer during the broadcast, and we'll continue live streaming on the internet after the show in after hours portion of the program. So call us, please. Please call us. 1-888-376-6225, or email your questions to ask@oncalltv.org. So this is your opportunity to be part of the show. We need you. Please give us your call. Yes.
Rick, did you know that it's 1-888-DRUNK call, basically?
Drunk?
The Doctor on Call, DRONK-RNCALL. So I don't know.
So here you go. Drunk call. Make a drunk call. Just a joke.
Sorry.
No, that's pretty good. No, that was 2 episodes ago. We had an alcohol show. That
okay.
was it. Okay,
All right.
but that's it. Yeah. All right. So let's talk about issues of beginning of life and end of life. And one of the things that happened to me today, they asked me to speak to the Parkinson's group about advanced directives. So if somebody said, summarize it in a couple sentences, Andrew, what would you say an advance directive is? I said Andrew, I'm sorry. Jeremy, tell me if you were...
I would say an advance directive is, while you still have all of your bearings about you, telling people what you want to happen.
While you still have your noodles.
Yes.
Be able
what to happen when you don't have that ability
capacity
to make a decision.
Right.
Mm-hmm.
Advance the questions about, would you want CPR?
Yeah.
Would you want to have a feeding tube?
Right.
Would you
Yeah.
want to go on a respirator?
Yeah.
Those
all
tough
those
questions.
things. Yeah.
And it really frees the family. Because so there's not so much burden on them to think, what would Dad want? You know, that way you can just
do what Dad wanted.
Do what Dad wanted and feel at peace with that. You know, whether it's planning their funeral or doing their advance directive, you know, to know that's what they wanted.
Yeah. You know, some of the classic cases, though, excuse me, I inhaled some of that coffee. We can talk about coffee. But the question is, some of the classic cases of do you pull a feeding tube or not occur in young people that were in car accidents, had major brain damage or huge strokes or unusual things that happen. And the family really struggles with that. And so I think a message that people don't hear much is we should talk to our family when we're old enough, when we're 20, about what would you want if you permanently lost your ability to know what's going on. You don't know enough to recognize your family, that members. Yeah. Would you want to be kept alive if you stopped eating and drinking with the feeding tube? I think that's the major question that we should ask.
And the question of hope. I mean, a lot of people base it on, they want us to predict, am I going to wake up in 5 days? Am I going to be able to eat in 10 days? With answers we can't give them sometimes.
No. I think stroke patients, the one thing I would say is that with a big stroke, a bad stroke, if you let them not eat or drink, because everything you put in their mouth, it goes down their lungs. Instead of immediately putting them on a feeding tube, leave them alone for a few days, let them dehydrate, let the edema of the brain reduce, give it their best chance, don't hydrate the heck out of them, don't give them IV fluids, give them a couple, 3 days, and then you have a better idea what's going to happen. And then you know where you're at. I think in this country, we put it in too many feeding tubes.
To drive the point home, I think, is the fact that you can have this conversation with your family at any age.
That's it. Let's
so when you're sitting down for Thanksgiving, go around and everyone say what you're thankful for, and then go around and everyone say, what are my wishes, or something.
Yeah.
I don't know.
Hey, that's a great idea. And morbid thought, but no. I mean, we live and then we die.
And that makes for a better, deeper conversation with your family, rather than just talking about
the weather,
the Lions and the Dallas Cowboys and stuff.
In the same vein, I think it's important too for a couple. I mean, even before death, you have one couple who one individual who gets a little demented, and the non-demented individual says, boy, is it time to put him in the nursing home? And they feel bad. And that's an important conversation, I think, to have right away, and give somebody permission. If I'm going to be demented, I want to give my wife permission to put me in the nursing home, not care for me 24 hours a day, 7 days a week. Yeah.
What about the idea of talking about these issues in the family sense and scaring the heck out of the kids? Is that going to happen? Or do we not talk about death enough with our children?
We obviously don't talk about death enough with our children. When you make it this alien, scary thing, that's what it becomes for them. And when you help them through it and answer their questions however you want to, then it might not be so bad.
Yeah.
We have an attitude in our country that we're not allowed to die sometimes. And I think you and I agree on that sometimes there's sometimes where it's just people's time to go. Sometimes it's not, but you know, I think when you have other family members involved, it's hard for them to let go sometimes, even if the person who's maybe ready to go wants to go.
Yeah, I think we have an inappropriate fear of death in this country.
We have a fear of death.
Yeah. You're a mortician's son. I mean, do you sense that's true?
Yeah, you know, I think growing up, you know, some of the families that wouldn't take their child to the funeral, I think that their imagination just ran wild, and so seeing them helped with the process of grieving.
Yeah, I think, you know, I'm a pretty healthy 66-year-old guy, but the reality is I know I'm getting older. I mean, I take care of older people, and I know that I'm finally really kind of grasping and grappling and facing my own death. And I don't really see it as that bad of a thing. And I do see the fear of it hurting people, causing problems, bringing on trouble.
Well, you thought this show was going to be on pediatrics.
Yeah. Well, we can talk about pediatrics. In fact, let's do this. Okay. Vaccinations have been proven extremely beneficial for the younger generation. But did you know that vaccinating your children can save those of the older generation?
As a pediatric nurse practitioner, I've been working with childhood immunizations all of my career. And after reviewing the World Health Organization information, I see the great importance it has for adults as well. Vaccinations have been estimated to have reduced about 6 million deaths worldwide. And in the U.S. alone, since vaccines have been used widely, we've got about a 99% reduction in 9 childhood illnesses. Prevnar vaccine was started in 2000 and routinely given for children, and it prevents streptococcal pneumoniae, which is pneumonia. The great thing that we've seen since the beginning of the Prevnar vaccine is that we've had a great reduction in pneumonia in adults, translated into grandparents and parents and people that are loving and holding those babies. We've decreased the number of pneumonia cases in children, and that has decreased the pneumonia cases in adults. Some children cannot be vaccinated. If you're under a year, it's too young to have that particular vaccine. There are many others that are safe, but it's not recommended for under a year, the measles vaccine. So if you're under a year, you're at risk to get measles if you're exposed. Now, if the rest of the population that can be immunized gets that vaccine, it's protecting the child who is too young. There are other instances where we can protect others by being immunized. If someone has an illness like leukemia that they cannot have a vaccine, they're protected if everyone else that is asked to get that vaccine gets it. Elderly people who are at declining health and may be at higher risk, people with cancers, they are higher risk for getting an illness, and we can protect them. The general population can protect them by getting the immunizations at the proper time. It's really been proven that the decrease in death rate and decrease in illness rate, morbidity and mortality, are reduced because of vaccines. And that translates to a lower cost for society by protecting the individual and not having the further cost of the illness. The cost of a vaccine is so much less than the cost of a hospitalization if a child or an adult needs to be hospitalized, but it also can be looked at as a savings with parents who may need to work and they're not home with their child for that week or longer when their child is ill from an illness that could have been prevented. Vaccines are very safe. In fact, they are safer than therapeutic medications that we give. So when we think about taking a medication for an ear infection for a child, that medication may cause more harm than a vaccine would cause. And yet our perception of the vaccines is skewed, and there's a lot of misinformation about how they can be dangerous. They are very safe and they are very protective. Look at smallpox being eradicated. That's the main illness we've seen that's been eradicated by vaccine. But we can get there with other illnesses if we keep our vaccination rate up.
Now, wasn't that a beautiful lady and a beautiful person inside and out? I happen to know her very well. So it's the Family Care Ask Anything show. So call us at 1-888-376-6225 or email at oncalltv.org and push the Ask button. Thanks for doing that, and we appreciate your calls. All right, I did sense that we're going to say something about vaccinations. I mean, she kind of nailed most of it, didn't it?
Yeah, I'm so glad she brought it up. I mean, you know, all the benefits from giving the babies the pneumonia shot and then translating that to adults. And just the last few months, they approved that pneumonia shot that we give to babies for adults. So now there's a second pneumonia shot for those over age 65.
Right. I checked it out today for sure. I was at a carrier advisory committee meeting, and we were being advised by CMS, which is, you know, Medicare, the financial people. They said, we will pay for the Prevnar shot, and then a year later the Pneumovax, or the Pneumovax, and then a year later the Prevnar shot. 2 shots now for people 65 and older. So I'm pumped. They've realized the benefit. Jeremy, agree?
I think that they definitely decrease disease.
Yeah.
Yeah, I think that the data definitely agrees with that.
Yeah.
Yeah. The struggle always is, I mean, a lot of parents have fear, like Joni mentioned in her video. And, you know, I think there's no great evidence that they do cause harm, but there's lots of fear that surrounds immunizations. There's no getting around that. There's no getting around that.
I would say that one of the things that we need to make sure that people hear is that we know that people are trying to do the right thing when they say, I don't want to vaccinate my child. I mean, they're doing that because they think they're doing the right thing. They're caring people, trying to make us a choice with the knowledge information that they have. But I just have to say to them that it's misinformation. And if you look at all the literature, and I have to say I'm Mr. Cynical. I mean, I think I question everything we do in medicine, but I don't question this one. This is a very important issue. It's worth doing.
Well, when I've never seen a measles case in my life, and none of the other parents in my generation have, and that's why some of them are not vaccinating against measles, because they've never seen it before. Why give my child a little bit of pain from a shot when it's not going to do anything? But obviously that's catching up to us now with the outbreak of measles.
Right.
And I'll echo your thought that they're good parents who
Oh,
don't.
yeah.
And to be honest with you, I have lots of parents who don't immunize their kids, and they are very educated typically, and they do everything right, it seems like.
So it's not that they don't care.
It's not that they don't care at all.
There's a paranoia out there. Some of it is that pharma and the medical industry have been sold a bill of goods or selling a bill of goods, and they're trying. There's a plot or something. I don't know what it is, but the truth is there's no plot. There's no. This is good medicine.
Well, and when 1 in 1,000 or 1 to 2 in 1,000 will die from measles, and 3 out of 10 will have a serious complication, it's not necessarily worth the risk.
Right.
Granted, most will get over it, but then there's the time off work and everything. I also wanted to echo the point about family care, as far as thinking of the community as a family, and like Joni said, protecting the kid down the street who can't be immunized, and protecting the 3% that get it that aren't covered either. The first vaccine is 93% effective. Once you get your second one at age 4 to 6, it's 97% effective.
And there's still 3%.
So there's 3% out there that have been vaccinated that aren't covered. And they were fine before because of herd immunity, because the measles wasn't circulating around. But now that it is, we got to get the vaccination numbers up there to help protect everyone.
Yeah, and the ones that I'm taking care of, the elderly. We know that the Prevnar pneumonia vaccine for kids has saved all these adults. It's just these older people or immunocompromised.
Another cross-generational vaccine, family care one, would be the Tdap, the diphtheria, tetanus, and pertussis one.
Tell me about it.
So pertussis is whooping cough, and whooping cough is on the rise as well, and that cough can last for 6-8 weeks, and it's no fun, and babies can die from it, and they can't be vaccinated right away either. And so one way to protect the grandchildren, we recommend grandparents making sure they're updated on their Tdap shot.
Well, that's a good point. Yeah, it goes both ways, doesn't it?
And you cough for 8 weeks even if you get treated.
Right.
That's the bad thing about pertussis.
You're sick for a long time from it. We have questions. Why can't older adults get childhood vaccinations? But they can. We have now giving Prevnar, the childhood pneumonia vaccine, to adults.
And a lot of those childhood immunizations, those older adults have had.
Okay.
MMR. I mean, if you were born before 1957, there's a good chance you've had every one of them.
You've got them.
You have natural immunity.
Yeah, or you've had the disease. That's the other thing.
That's what I mean. You have natural immunity.
Natural immunity.
Now they can get if they're traveling to a country somewhere where measles is endemic, they do recommend either getting tested to make sure your immunity is good or just getting a booster.
Yeah.
But for the most part, no, we don't recommend everyone come in and get a booster for it because it's not necessary.
All right. We've had great questions coming rolling in, so let's go quickly on the answers. Here's one from Alcester. The 64-year-old male caller has a cat with parasites. Please discuss the signs and symptoms of pinworm, what can be done to treat pinworm, and you also might want to talk about pregnancy and sick cats. Pinworms.
I've got some close friends that they brought their kid in because they were worried about him having pinworms because he was rubbing along the carpet with his butt.
Bottom.
Yeah, and so then I did the old Scotch tape test because if you have pinworms, you can have eggs on there around the anus. So I put the Scotch tape there, and then from now on, with that kid, I'm known as oh, that's Dr. Ellsworth. He'll put Scotch tape on your butt. But
the answer is, did you find pinworms?
He didn't, and I didn't treat him, and he got better. But it definitely does go around. And the main symptom, Jeremy,
itchiness. I think you use CeraVe hand cream for itchy bottom and clean it if there's not pinworms, because it can get dry there and people can get over cleansing. Jeremy, any comment? I didn't call you.
I was going to follow up on his story, but I don't know if I should take the time.
Let's hear it.
So this child's mom was telling me the story that they went in and they had the Scotch tape, and she had asked Andrew if Wyatt has pinworms, does the whole family get treated? And I joked, of course, nope, everybody needs the Scotch tape test after that.
That's great. We have a caller, I don't know where it is. 64-year-old man from Sioux Falls. Caller has had measles, is traveling to an area, is likely to be exposed. Should I have a booster, measles shot? And the answer is, yeah, probably. We just answered that.
Yeah, I mean, if it's an area, if they're traveling to Mitchell or Sioux Falls or Disneyland, you know, and they know they've had measles in the past, I probably wouldn't really recommend they get a booster. But if they're traveling to Africa or wherever, yeah, probably wouldn't be a bad idea. India, yeah.
Yeah. And then here's another question about when should children by age get started on vaccinations, and we've discussed that. Do you, some people spread them out. Do you believe in this schedule that the CDC has recommended, or would you spread them out?
My patients all typically get it on the CDC recommended schedule. I have some that spread it out, and
they want to spread it out. You say, okay. Yeah. You don't fight it?
I don't beat them over the head.
Okay. 92-year-old man, why do my feet swell around nighttime? Good question.
You know, there's a lot of reasons why that can happen. In general, compression stockings can be quite helpful, you know, avoiding salt. You know, if you don't know why, then I'd recommend seeing your doctor to get worked up.
Yeah.
Gravity.
Gravity is the biggest part. Yeah. They say 50% is venous insufficiency, and the others are heart failure, liver failure, and kidney failure, or liver disease, kidney disease, heart disease. Yeah. Not necessarily failure, but that means see the doctor.
Right.
How about 3-year-old grandson has influenza A first week in January, now has slight fever, 99.2. Daughter has taken him to the hospital 3 times, and they say nothing is wrong with him. Have the docs seen this before?
So, you know, influenza is not the only thing that causes a fever, and the most likely thing is that the child has a viral upper respiratory infection or a cold. And as long as he's doing okay, and they've got him assessed, and you know, they get exposed every 2 weeks to a new cold. So
yeah, could be something else. I always make this point, though. I had a dear friend who had a bad influenza. I'm sure it was viral. Just everything, runny nose, just sick as all get out. And that's the first day or two, fever, ache all over, feel lousy, and then the next 2 weeks the cough is the typical story. Yeah. But on day 3 or 4, he got shaking chills and a fever again, right? Well, I'm just a cold.
Yeah.
He didn't come in. Well, it was pneumonia.
Yeah, pneumonia.
Yeah. So you know, most pneumonias are preceded by influenza or a cold, and then they get it. But giving a person an early antibiotic only gives you a higher risk of a resistant pneumonia. So don't take an antibiotic for it. It doesn't protect from pneumonias. Just be aware that day 4, 5, 6, 7, 8, if you're running shaking chills and fever, better be evaluated. This one did. It's okay. I think you've like you say, it's probably another.
Yeah. We see it all the time, to answer the question.
Yeah, we see it all the time.
But I think there's a great point you brought up, is that, you know, it's not like the minute you have symptoms you should come in and get antibiotics, because like you said, it could backfire.
Yeah. It backfire. Please discuss fever in children. Is there a certain level at which I should be concerned? Does it depend on the age of the child? What's the febrile seizure? And how can I prevent them in my child? So let's talk about fever. We just talked about fever. Most of the time they're virus. Yeah. When do you need to respond to a fever?
You know, I don't know that there's a specific number. I will tell, you know, I've seen 104, 105 in little kids, and they respond much more dramatic than you and I do. I do tell parents, though, if their child has a temp of 103, 104, it's good to have them looked at to see if they have some clear source of fever. But I think a lot of parents leave disappointed when I say they have some viral infection, and it's going to go away in 4 or 5 days.
Right. Do you treat a fever with you know, Tylenol or something to keep them from having seizures?
I don't think that Tylenol prevents seizures. It's the, you know, that dramatic rise in fever is what causes the seizure. It's not the 104 that causes the seizure.
It's the rise.
It's the rise.
And if you give them Tylenol, it'll go down, and then it'll go up again, and so you set them up for
And I usually tell parents to treat with Tylenol for symptom control. If they're lethargic, if they're miserable, if they're not eating.
But don't treat a fever.
I don't think you have to treat a fever.
But if they have a history of febrile seizures, and that's a seizure from having a fever, which most of the time is a benign thing and nothing to worry about, but we do recommend, you know, trying to keep the fever down with Tylenol and ibuprofen to help prevent a
Yeah, that's reasonable.
seizure.
Yankton, my 6-year-old has such a stuffy nose that he's having trouble breathing, sleeping, eating. What can I do to help him? Stuffy nose, 6-month-old. Isn't that the suction bulb? That's what we did. It's not a great treatment, is it?
I don't do a lot of suction bulbs. I don't tell parents to do a lot of it unless you can see it. I tell people to do lots of nasal saline drops and call it good.
Okay.
You know, some kids all winter long, they're just constantly congested, and their little airways are small, and it easily gets congested, and you know, you
Tough
do
question.
the best you can.
Yeah, do your
Do
best
the
you
best
can.
you can.
Yeah. The art of the family dinner has disappeared over the years, but our on-call dietitian has some tips on how, with just a little planning, we can simplify cooking a family meal.
As families get busier, we tend to eat less healthy and eat out more often. Planning ahead can help you provide healthy meals and more home-cooked meals for your family. Planning ahead will also allow you, as a parent, the ability to continue to instill in your children the importance of living a healthy lifestyle and keep you healthy too. Start with a little planning. Plan a menu for each week based on your activities. Grocery shop ahead of time and assign duties for cooking within the family each night. I might also suggest trying freezer cooking. Freezer cooking is preparing foods ahead of time and putting them in your freezer for easy access. When freezer cooking, the first thing you need to do is choose a recipe. The next thing you need to do is choose what you're going to put your recipe in. One of my favorite things is a Ziploc bag. The first thing I've done is write the recipe on the Ziploc bag and write the preparation instructions so I know how to prepare it when I pull it out of the freezer. Today we're going to make cilantro lime chicken. The first ingredient is chicken. Choose either 2 large chicken breasts or 4 small chicken breasts and put them in your Ziploc bag. Next, add 1 onion chopped and add it right to the bag. 1 can of black beans rinsed and drained. Add 1 can of corn or 2 cups of frozen corn. If it's a can of corn, make sure you drain it. Next, you'll add 1 bunch of cilantro that's chopped. Not a large bunch, just a small sprig that's going to be chopped. And the final ingredients include 2 teaspoons of chopped garlic, 2 teaspoons of cumin, and the juice from 2 limes. Once you have it all in the bag, get as much air out as you can, seal it, and flatten it to put in your freezer. When the day comes that you want to prepare the meal, pull this out of the freezer probably a day ahead of time to let it defrost. Put it in your crock pot and follow the instructions. This recipe reads to cook on low for 8 hours or high for 4 hours. This makes a great meal to throw in the crock pot before you leave home in the morning to have ready when you get home at the end of the day.
Yum, Katie. Did you share that with anybody else? So the question is, and I would throw it at you, how valuable do you think that time eating around the table with your family is for a family?
I think it's very valuable. Yeah, and I think Katie hits on some of the reasons it's valuable because it's far better nutrition. You typically make better choices, but I think that's a great bonding type of time for families to kind of get away from the stress of the world.
Yeah.
Yeah, I was going to echo just the connecting with your child. I mean, right before coming here, my family had a meal together. It wasn't a fancy big sit-down meal. It was leftovers, but we ate together, and we I encouraged my 5-year-old to eat everything on his plate, and we went back and forth making deals on how much and what he gets if he eats it. But usually we get him to try it, and we're interacting and we're having fun, and we're eating healthier that way.
Well, I mean, there's studies that show that when families eat together, there's a lot of mental health that comes with it. Communication time.
Mm-hmm. What I fear is when they're older and they've got all these activities to go to, and making that a priority. That's what's going to become tougher, but we're going to have to do it.
Well, that's it. I mean, I think that in my household, I came home late. They always waited for me. But some of the time, they're off at play practice, or they're playing this sport, or they're gone doing this. I mean, you do as good as you can do.
Yeah.
There's almost too much of that, though. I worry.
Yeah. We're maybe too busy in our lives, yeah.
Yeah. There's a way to say no to.
Yeah, there is.
And not just the meal, but in general, making time for your family to just be together and making your house a peaceful home. Rather than just chaos and the TV blaring and everything. I think it's something our society hopefully can get better at.
Yeah.
Via email, what is a good pH for your body to maintain your immune system in good order? Now, I'm thinking that they've been advised that certain supplements make the pH different. What's your take on that?
I don't know. I think you could make arguments both ways. I mean, we know in medicine that if your pH gets too low, you struggle. If it gets too high, you struggle, and our body has mechanisms to kind of get it in the right spot.
Is there any supplement, or is there any particular food, or is there anything that you can do to change your pH, or does your body really do it automatically?
I think your body does most of it automatically. And some of the stuff I've read about people wanting to control their pH, it's usually done by foods that are healthy. And it's probably not the pH, it's probably the foods that are making the difference. That's my take on it.
Yeah, I mean, you can go for some yogurts and live culture bacteria yogurts and everything, and some probiotics, and to a certain degree that's fine. Yep, that's good. And we recommend it, especially after like antibiotics and going back again to unnecessary antibiotics and messing up the GI tract and yeast infections and everything else. One interesting point I got from a pediatric GI specialist was, we talk about the benefits of breastfeeding, but it's not just the milk. There's the actual, of course, bonding from breastfeeding, and the actual physically getting the bacteria from mom's breast from breastfeeding, and that getting a hold in the baby's GI tract, and that helps them become healthier too.
Right. So I think your comment of bringing it to breastfeeding and a balanced diet is the right answer. I know you can raise your pH by over-breathing. You hyperventilate, and you get, because you're anxious, your pH goes up. The best way to bring it down is to go for an exercise program. If I want to do something for your pH, I would say, go exercise on a regular basis.
Or use your CPAP machine if you have sleep apnea, or get checked for sleep apnea.
There you go. Now, those are pH issues.
Yeah.
Okay, how about, does dementia tend to be hereditary? My mother's sister had severe dementia. My 77-year-old mother is showing signs of it. Also, she's aware of it, but her physician doesn't take her seriously. What can I do to help, and what treatments are available for dementia? Is it familial, and how can you prevent it quickly?
I think a lot of it is familial. We do see it run a lot in families. What can you do to prevent it? You have to, I think, do the things you talked about, eating, exercise, and you have to really keep your mind working.
Yeah, communicate with people.
Yeah. Read and crosswords and...
They found nuns that were reading the paper every day to find things to pray about. Those nuns were staying pretty sharp because they were up on current events and they were thinking about things and using their minds.
As opposed to the nuns that were not reading very much.
Right, yeah, and that's what they looked at.
That was true.
Yeah.
Do the docs think physician-assisted suicide will be included in the advance directive at some point?
I suppose.
In this state, we don't have it. What do you think of physician-assisted suicide?
I don't think it'll happen in South Dakota. I don't agree with physician-assisted suicide personally.
Okay. What do you think?
I am not going to be interested in it, but I'm sure I'm sure it could come, just like medical marijuana and everything else.
That you wouldn't have predicted would have come.
Right.
I'll give you my take on it, and I'm the older of the three of us, okay? And I've lived this world of caring for people. I'm a hospice director. I try to give compassionate care. My dad had a pretty bad end. So if anybody was going to be in favor of it, it would probably have been me, and I'm not in favor of it. I think that nature allows death if we don't get in the way pretty naturally. And if they're in pain, give them the pain medicine. And if that brings them to an earlier death, so be it. My intent, however, is never to kill them. My intent is for comfort. And then it seems to work. I don't think we need to do the physician-assisted suicide thing, although I have to say that there are cases where they are so miserable that one can speak about what is called putting them into a coma to make them comfortable until nature calls them.
I sympathize with people who like the idea of physician-assisted suicide. I really do sympathize with them, because there's a lot of miserable people that at the end of their life they're in a lot of pain. And
I heard it discussed the other day on the radio, and the dilemma is the biggest reason people want to do it is if they get demented. I don't want to be demented. I want to end my life before that happens. But when you're demented, your judgment is compromised. So when do you make that choice? Well, you can't. I'm starting to get demented. Well, how demented are you?
Right. I think it just more importantly, or knowing when to stop all these other treatments, stop the things that we're doing to them, and like you said, let nature take its course, or
I think nature does a really good job of letting us die when we need to die. I don't know that we need to. And who am I to be the one? So, I give you a prescription, you take it, right? Well, then they take it, they vomit half of it because they get really sick, and then they half die, and then they end up, stroked from it or something. It's a sticky wicket. I'm not comfortable with it. Others may be, and I'm not compromised. I'm not going to say I'm right and they're wrong. I'm just saying, not for me yet. How about before seeing patient, do you review the chart?
How often?
No. Before you see the patient, do you review the chart?
If it's a new patient to me, I review the chart. If it's a patient who I've seen 100 times, I don't review the chart.
I often will go in and go back over my last note while I'm sitting in front of them and listening to them and talking, and I kind of do that.
And unfortunately, that used to be a lot more valuable when there was more personal information in it. And I know, Rick, that you still put quite a bit of personal information, and I try to put. And it's hard to find the good stuff. No, just kidding. That is the good stuff. But and I try to put some of that in too, because it's so important for connecting with the patient and knowing more than just the medical stuff about them.
There are certain limitations to reviewing the chart that we could take an hour reviewing somebody's chart.
That's right. And particularly if it's my rambling note. Is that what you were trying to say to me?
Just everything that they've had done.
And the other area of this is, I think some people figure, well, if it's written in there, I know everything there is in their medical record, and it would, like you said, it could take me 2 weeks to read every word. So
I really kind of need to touch base on my last note as a rule, and I generally do that in front of the patient. I generally dictate my note in front of the patient. I don't know if you guys don't do that.
I don't dictate in front. I don't have time.
I hardly dictate anymore.
Okay. Do you recommend a 68-year-old? Actually, we've got 3 questions about shingles. Recommend a 68-year-old with COPD and celiac disease who had chickenpox at 14 to get shingles. How often pre-diabetic with a number between 120 and 130 should have a checkup? That's not a shingles question. We've got 3 shingles questions, but let's talk about the shingles vaccine. Okay.
So
do you recommend
chickenpox, I think it's a good idea to get it, unless you want to get shingles.
Right. And it's like 50% effective. I mean, it reduces your risk for shingles 50% and your severity by 50% if you do.
And that's probably the key. It reduces the severity. Because it's no fun. I've had shingles, and it's no fun.
You have?
It's not a perfect vaccine by any means. And typically we recommend at age 60. So I think that example was 65 or 64 or something, so I would recommend it. If they're age 50, they can get it, but we typically don't recommend it yet, because it may not give them the best protection for later when the evidence showed that's when we should do it.
Right. a 55-year-old with stage 3A lung cancer, should they have both types of pneumonia vaccine shots? I would say yeah.
Probably.
So yeah.
People with asthma should have both shots. People who've had diabetes should have both shots, whatever age, right?
Yeah.
You agree?
Yeah, but a year apart.
A year apart is the deal.
Yeah.
Okay. How often a pre-diabetic with 120, 130 should have a checkup?
Well, I would say if somebody's pre-diabetic and they've had routine blood sugars at 130, they're diabetic.
Yeah.
If it's fasting, they're diabetic.
Well, that by 125 is the cutoff,
yeah,
right?
125 is that cutoff.
I
and
think
so,
that's a number, isn't it? Yeah.
So I would say that that individual, I mean, I think they need to have one very good exam and then find out what their A1C is, find out what their risk factors are, and base your appointment schedule on those numbers.
What is the hemoglobin A1C?
It's a number we use to tell you what your blood sugar has been for the last 3 months, approximately.
So it's an average.
It's an average.
For 3 months.
Yeah. Yeah.
And it's a blood draw.
It's a blood test, yeah.
You get it when you come to the doctor.
Yeah. If you're diabetic, usually.
You know, if they've had the A1C and it shows that they're pre-diabetic, I don't think they necessarily have to come in every 3 months.
No.
You know, maybe 6 months, maybe 4 months, depending on where the rate has been. Are they stable, or is this a brand new thing, and do we want to keep an eye on it before it gets way out of control?
Yeah.
So.
And I spend a fair amount of time at that point with the fact is, here is a golden opportunity to change your lifestyle.
They need to aggressively change their lifestyle.
Right. And some of those people are also the ones that should get sleep studies.
Yeah.
They should get sleep studies. The people who are having palpitations should get sleep studies. The people who have
snoring and apnea should get sleep studies for sure.
Sleep studies, we're not doing that enough.
Hard to control hypertension.
Hard to control hypertension, yeah. Obesity, thick necks. Pediatrics have, this is a 70-year-old asking, have the docs noticed a decline in autism? And the caller only knows people with autism in their 20s. Do you think there's a decline in autism, an increase in autism, and do we have a clue of what causes it?
I think we've probably seen an increase in autism because we look for it more.
Right. And we recognize it.
And we recognize it.
We know
yeah.
what it is.
Yeah, and then we have this big broad spectrum of
it can be
autism.
kind of mild
yeah.
and it can be severe. So what the question I would have is, do we have any clue why it occurs? Family history?
We don't.
We don't know.
Well, there is one study I had seen that older parents increase the risk of autism. And our society is having children
as an older age.
So
and
that
I've
could
seen
be part of
something
it.
that says fever in pregnancy increases your risk of autism.
Right.
So there's lots of associations out there.
Exactly.
Yeah.
That we can't say for sure it causes it.
So what
just so
causes it?
happens.
I do know this, that huge studies have been done to look to see if it was vaccines, and the answer is no difference in groups.
Yeah.
With or without, same amount. It's not vaccine.
A national autism organization put on their website, go get vaccinated for measles. And my brother loved it, and he gave them a donation because he was happy about that.
That's good. 83-year-old had shingles. Does she need a shingles shot? Yep, and the answer is we said yes.
I think so, yeah.
If it was greater than a year ago is how we've got 30 seconds. What are the doctor's thought on diabetes medication and blood sugar management? So some people say we should spend more money on management. You know what? We don't have time. Let's go to this. We'll be right back after this.
All around town, from stores to playgrounds, babies are on the move. And there are diseases that are on the move too. And some of these spread easily. To best protect him from 14 serious diseases by the time he turns 2 years old, vaccinate him according to the recommended schedule, so he can go on about his business and you can have peace of mind. For more reasons to vaccinate, talk to your child's doctor or go to cdc.gov/vaccines.
It's a cruel world out there. Consider how some people are so angry they're cutting heads off and burning people alive in front of video recorders, likely for the very purpose to bring us to hate. Anger, bigotry, hate crime against those different, and even, I dare say, polarizing politics can be found everywhere. The old adage rings true: to destroy your enemy, make them hate. About the destructive power of hate, Buddha said, holding on to anger is like grasping a hot coal with the intent of throwing it at someone else. You're the one who gets burned. Another philosopher said, while seeking revenge, dig 2 graves, one for yourself. But it can go both ways. A research study not only showed how people negatively treated a stranger when dealt poorly by the study director, it also showed how people positively treated a stranger when dealt kindly by the study director. But do we really need a study to prove the simple truth that we all find it easier to be a good person when we're treated well and find it easier to be mean when we're ourselves abused? The rub comes with the difficulty getting into the habit of treating others with kindness. Confucius said it's easy to hate, it's difficult to love. All good things are difficult to achieve and bad things are very easy to get. Last week, a group of pre-med students were asking me about how much volunteerism is enough to help get them into medical school. One student honestly stated, "It's hard to be altruistic when I don't really feel the love in my heart, and I don't want to be a hypocrite." It made me remember a sermon given by a favorite minister a while back, suggesting that if we don't feel the milk of human kindness, we should go through the motions and act like we do. The more we practice, the more it turns real. I believe this is true, but it's difficult and it takes time. My lifetime job in the medical field as a physician has required very active listening. And I've noted that kindness, even if it's not completely heartfelt, is the most powerful and curative of medicine, my favorite and most helpful treatment for almost every illness. Over the years, with all that practice, the caring has only turned more genuine and thus more rewarding. I'm not suggesting tolerance to injustice, but in this world where there remains hate, cruelty, radicalization, and polarity, we should realize our best weapon might just come with patient kindness. Well, this brings us quickly to the end of this evening. What a fast show. For more of this discussion and answers to the questions we didn't answer during the show, join us for After Hours by going to our website, oncalltv.org. I sincerely thank our fantastic guests tonight, Andrew Ellsworth and Jeremy Beireis of the Avera Medical Group, Brookings, and the Brookings Health System. Novelist and author of Roots, Alex Haley, describes family like this. In every conceivable manner, the family is linked to our past and a bridge to our future. And from our on-call family to yours, until next time, stay healthy out there, people.
Charles Dickens said, "There is a wisdom of the head and a wisdom of the heart." It is more than a pump. It is the place where our lives get their rhythm. Wisdom of the heart, as we are on call with the Prairie Doc.
Funding for On Call with the Prairie Doc is provided in part by
Avera is a proud sponsor of On Call on South Dakota Public Broadcasting.
Larson Manufacturing is proud to support On-Call Television as it continues to open doors for important medical information.
And by the South Dakota Foundation for Medical Care, the medical care quality improvement organization for South Dakota. Additional funding is provided by Aberdeen Allergy and Asthma, Brookings Health System, Dr. Mark Bubach with Dakota Allergy and Asthma, Dakota Care, Dakota Dermatology, the Orthopedic Institute, Physicians Care Sanford Clinic Community Service Committee, and Swiftel Communications. Closed captioning for On Call with the Prairie Doc is provided by the generous support of Avera, Brookings Health System, and Fishback Financial Corporation.
Hello and welcome to On Call After Hours, where we answer the questions we weren't able to get to during the broadcast portion of our show. All of your questions are important to us, so we want to answer them as many as we can, and there are a lot of questions, so let's go quickly. One of the main reasons people have grown leery of vaccinations is because the whole truth wasn't being told for so long about what's in vaccines. If medical professionals quit dancing around the issue and directly talked about whether or not metal additives such as thimerosal is in certain vaccinations, it would empower them to make informed choices. What's your response?
You know, I think as they've taken this stuff out of them, I think that autism rates have stayed the same, and that's always been the fear.
Right, and it's basically a very, very low dose of something to preserve the vaccine so it doesn't deteriorate, so make it safer. And it's about the same amount of mercury as you'd get if you have a can of tuna, right? I mean, it's...
But they took it out. And that's one issue as we go back and forth. We're answering it both ways. You know, we're saying, oh, but it's safe, and oh, but it's not there. And that's where some of that comes from the public. Just like the ingredient they were, in which, you know, that they were worried about causing autism and whatever, they took it out. But then which some would say led some credence to, well, then what was wrong with it, you know? And so, unfortunately, but they did it because they didn't want people to have to worry about it.
Right.
You know?
Yeah, and that's the point. Although, do you think that we're 100% informed and 100% uninfluenced in the, I mean, do we ever dance around any topics? I mean, are we 100% honest? I mean, I try to be.
Honest but informed is the question. I mean, boy, we can't know everything about everything.
What in medicine is 100% anything?
Yeah.
Yeah.
You know.
So I think, all you can do is ask us to try to do our very level best. Be honest, be kind, and respect people's choices, Via email, I've heard a lot about elderberry syrup supplements. Is this safe for children in regards to colds? And does it make a difference? Safe?
I have no idea.
Yeah. Just because it's natural doesn't mean it's safe. And most of our drugs come from natural things, really. Because we just studied them a ton, and that way we know they're safe.
Yeah. How contagious is shingles?
Not very.
Not very.
If you open up the blister and touch somebody who's never had chicken pox, then there's a chance to pass it on. If it's covered, boy, it's not very contagious.
Yeah.
But you can't get shingles from someone who has shingles.
You're right. That you can't get shingles from somebody who has shingles.
Yeah.
You get chicken pox from somebody who has shingles.
So shingles are what? I mean, chicken pox, but now only in a nerve?
It's the chicken pox virus that comes out in a certain area of the skin.
And it's been sitting there for...
Sitting in the spine forever.
Okay. Please discuss C-reactive protein.
It's an inflammatory marker. It's not very specific. It can be used for looking for infection. It can be used for looking for cardiac disease. There's other things that can be looked for too. And so if it's high, we don't necessarily know what's going on.
Yeah, I'll be honest with you. We had a SED rate when I came along, and they said SED rate, it shows there's inflammation somewhere. It goes up in about half of all the diseases we have. It's not a very good marker. It doesn't tell you much.
It's not specific enough.
And that's what C-reactive protein is. It's the same thing. It's just an inflammatory marker. Don't make anything of it.
Yeah.
But if it's normal, it can be reassuring.
It can be.
Yeah, but if it's not normal, then you go, well, something might be happening somewhere. That's a normal, it's sort of like, what is it, the test that we use for pulmonary emboli? A D-dimer. When the D-dimer is normal, okay, you don't have PE. If it's elevated, well, you might, but you could have a million other things. 83-year-old woman has frequent urinary tract infections, always empties her bladder. How can she prevent future infections? Any specific foods or fluids? I like vitamin C, and I tell them 4 times a day, and I think it helps. What do you think?
I think it's reasonable to do cranberry juice too.
Oh.
Yeah. I mean, there's sometimes surgical options, there's sometimes medication options, but
I think you need to be tested and checked, and maybe there's a problem that's causing infection.
Sure.
81-year-old daughter has malignant hypothermia. What's that?
81-year-old?
81-year-old daughter has malignant hypothermia. What is it?
well, it might be malignant hyperthermia, but it says hypothermia.
Yeah, but I think it's malignant hyperthermia. That's what it is. A person who goes to anesthesia and their temperature.
Right. It's too high.
So you got to be careful going to anesthesia.
Yeah.
That's the key. Anything else to know about that? Malignant hyperthermia. Pancreatic cancer survivor, healthy sisters dying, having something. Likelihood of children of getting cancer to watch for. So that's the question. Cancer history, cancer of the pancreas history, does that mean there's a risk of cancer?
Yeah, I mean, that's the fascinating thing in medicine over the next several years will be being able to test for some of these genetic causes of cancer that run in families. And we can do some of those tests now based on the history, and we're going to be doing a ton more in a short amount of time. Right,
the genetics, for example, the genetics for prostate cancer. So you do prostate testing, it's abnormal. Do we worry about this cancer? There's a low-grade cancer in your case. Do the genetic test, they're thinking this is right around the corner, it's not here yet, but not ready for prime time.
Yeah.
But then you go, no, this is this smoldering kind of cancer probably in your family. You're likely not to have the bad kind.
Yeah.
Let's just leave your prostate where it is.
Sure.
But there's plenty of cancer that has nothing to do with your genes either. So.
Right. Yeah, so the answer to that is maybe, maybe not.
Yeah.
Maybe you have to be married, maybe you don't.
Boy, doctor, you're so wishy-washy.
Yeah, I know.
Dr. Rick, which is more infectious, measles or Ebola virus? And what is the difference between an airborne infection and a bloodborne infection? Okay, so what's the difference? What's more infectious?
I'm guessing measles would be my guess.
More infectious than Ebola.
I think if Ebola was as infectious as measles, all of Africa would have Ebola.
Yeah.
Well,
that's
the
my
whole
opinion.
world. It would have
the whole world.
And that's what they're worried if it were to develop that type of
right.
And they're so that's part of the reason why they're just scrambling as hard as they can to get a vaccine.
Sure.
What about airborne versus bloodborne?
Well, when you get in respiratory by breathing it in, whether someone coughs on you or it's hanging in the air or it's on a surface, and like measles, it can be you can leave the room and 2 hours later someone can get it. Whereas blood, where you need to be in contact with the blood,
fluid, like HIV or hepatitis
or
Ebola,
like
that. Or Ebola.
Yeah. See, so measles airborne, Ebola bloodborne.
Yeah.
When should a COPD patient slow down and possibly enter hospice? Patient enjoying life, walking, but how much longer will this last until it goes downhill?
It's hard to say.
Do it while you can.
Walk as much as you can.
I would say walk as much as you can, enjoy life as much as you can, stay as active as you can, and your lungs will hang in as long as they can.
I think when it looks like you need to be on a respirator shortly, that might be the hospice call.
Sure.
I do think that there's a time when a person who has COPD and is really compromised, but still active and doing fine, don't need to say hospice, but they can make an advance directive that says, I don't want to be intubated. That might be what I would do. Nursing home care would like the doctors to address how middle-class families are supposed to afford elderly care, nursing home care.
Yeah, I mean, of course, you can get into insurance and everything else, but
it's difficult. It's difficult financially for caring for an elderly person.
Yeah,
it really is.
I will give you my answer. My mom used up all the savings that she had.
Yeah.
So I wasn't going to inherit anything from her because she was in the nursing home. She used up everything she had until she cranked it off until it was all gone, and then I had to buy the lake cabin. Right? Didn't you know? Paid her for the lake cabin. Had spent all that.
Yeah.
Then she was eligible for Medicaid.
Yeah.
And she had Medicaid for half a year.
Yeah.
And I think you have to, if you don't, you're not responsible for when they run to the point you just let Medicaid kick in. I mean, you know, live your life. Let your mom. I'm not a fan of the insurance.
Not a fan of the insurance.
How about what can the 87-year-old caller do about restless leg syndrome?
So there's certain medicines that we can take to help settle them down a little bit. I think I've found people that are more active seem to have less trouble with restless legs.
Stretching at night,
I think
be more active, and then there's the Mirapex and the anti-Parkinson medicines that help. Cinemet's the only problem in Cinemet sometimes drives it.
Yeah.
It's a tough one.
Yeah.
Would docs talk about celiac in newborn babies? Great-granddaughter is having issues.
You know, my baby girl had some issues, and we tried you got to try the milk-free for a while and dairy-free, and maybe even try and then they grow out of it, and it probably wasn't celiac or anything to the first, maybe it was just colic, who knows. But when you're in that position, sometimes you do everything you can, and if it seems to help, you do it. But
she grew out of it.
Yeah.
I mean, the irritable gut, some little kids get irritable gut, don't they? Yeah. What do you suggest for irritable gut? Do you give them molasses or milk-free, or you go through a series of things?
Patience and earplugs and warm packs to the belly and lots of comfort. It's hard.
It's hard.
That's a hard one.
What do these physicians think of steroids for children with asthma, and do we need to worry about side effects?
Well, we try to minimize it as much as we can, but if they're in an episode where they're having trouble breathing, they need the steroids just to help save their life.
Right. Go inhaled as much as you can.
Yeah. I'd say avoid the oral stuff as much as you can, but like you said, sometimes you need them.
Or they're dead.
You need to breathe.
Or, yeah. There's a nice thing about breathing.
Yeah.
You know?
And then get off of them.
And then get off of them.
Yeah.
Parkinson's disease, 5 years ago, came down with it. No symptoms yet, but what can I expect? It varies. My answer to that is some people do very poorly. I mean, over time. Some level off.
Yeah.
But the best they do are the exercisers.
Yeah.
Right, yeah, I was going to say.
Right.
You know, people, it's a movement disorder.
Yeah.
Get moving and stay moving.
Therapy.
Yeah.
Use it or lose it.
But if it gets bad, you can expect that short shuffling gait. You can expect to lean forward a little bit more. You can expect some tremor, some forgetfulness potentially. All possible.
It depends upon the person.
Yeah, it really does.
Yeah, it can change. Well, and let me put it this way. And then we're all going to die.
Yeah.
So there you have it. What do we expect at the end of our life? It's going to happen. Advice on signing up for health insurance. He's got pain in his foot and can't see a doctor without insurance.
That's what the new health exchange is for, I
It's
guess.
supposed to help, yeah.
Yeah.
So I'd say, you know, log on to the government website and look at the best options for you and
Get it?
and go ahead and, yeah, get it if you can.
Yeah. We should all encourage people to do it. What causes nighttime sweating early in the night?
There could be many reasons. Sometimes scary reasons, sometimes nothing. I mean, so is it a blood cancer, you know, or is it hot flashes? Is it menopause? Is it, you know,
A low-grade fever from tuberculosis or from a little nail infection?
Or is your room too hot?
Or
yeah.
it could be a lot. I'm old enough to have had all the childhood diseases. Since children have been getting the shots for 60 years without widespread problems, isn't that proof enough that they're safe? I think you know, that's really true. There's a lot of proof that it's safe, and I think she's just saying, isn't the fact that they've been getting shot for 60 years? Think about all of the improvements. I think the studies show a great improvement. Why are family and friends hesitant or avoid spending just a few minutes with old friend or old relatives?
You know, I want to go back one more time with this because
Okay.
I mean that's the problem with my generation is that we didn't see the floors of kids with polio and the neighbor children and other people with paralysis, and we didn't see all the measles and the deaf, dumb, and blindness that came, and you know,
It's kind of taken over the show, isn't he?
He has. I mean, you know, that's right.
yeah, hammy though.
So, but that's really true. I mean, I think the fact that my mother sweated polio and she wept the first day the polio vaccine was available to me. She wept and she carried me to the doctor.
Yeah.
Family spending more time with old friends. People are afraid to spend time with the older people. Sometimes they're afraid to spend time with the people dying of cancer. Why is it? Younger people are less willing to hang with old guys like me. I mean, what is the problem there?
You know, I don't know. It's maybe a philosophical type of thing. Maybe they don't like to see somebody in that state. Maybe that makes them uncomfortable. Maybe they have a fear of death themselves. Boy, it's hard to say.
And people are busy.
Yeah.
And that's a dumb excuse.
Yeah.
But they live their lives, and you know, it is important to make time to do those things.
Mm-hmm.
And you know, it used to be that older people sometimes had an odor. And if I were an older person and I wanted to have visitors, I would make it springtime in Febreze, and I would have fun, and I would not demand that they come and visit me more, because if you want them to go away, demand that they visit more.
And sometimes people can do more to go out themselves and interact with other people.
There's a ton of people at our community life center and our community, what is it, they have activities at the community, I've forgotten it, but there's it's that, it used to, right next to the library downtown. There's tons of activity going on in this town. Senior Citizen
Activity
Center. Senior Activity Center. 75-year-old got vaccinated when she was a young child, and is the vaccine still good? Depends upon what kind of vaccines.
Yeah. But there's a good chance it probably has some efficacy. But there's a chance it could be.
I think they could use it some more.
I mean, generally, we're anyone born before 1957, we're not recommending you need to worry or think about getting a new MMR vaccine anyway for measles.
Okay. 57? I'm trying to decide if an 88-year-old woman should get the shingles shot. One doc has advised a blood test first to check the immunity to shingles before going ahead with a shot. Is that what should be done? Are you checking shingles vaccine immunity? Shingles immunity? I'm not.
Just give it.
I'm just giving it.
Yeah. Yeah, I don't check anything.
No. I'm recommending it for people 60, actually 65 or older.
Yeah.
It's a little spendy. Most insurances are now covering it.
Yeah.
When I had it, I had to pay the whole thing.
Yeah.
And then they cover it, I think, a month after I had it. How come insurance won't pay for shingles vaccine? But it will. It depends upon the insurance, though. It's getting better.
Because insurance companies are trying to save money.
Yeah.
Yeah, it's a mistake. Caller had a measles shot in the 50s and feels that vaccines were not questioned. Why are people more resistant now? I mean, and the question is?
Because we have internet.
It's the internet.
We have a lot more. There's a lot more questioning. There's a whole lot of media that, I mean, in the 50s, they didn't really.
They just said, the doctor, I trust the doctor.
Yeah. And there weren't stories of, you know, people expressing concern and fear and that type of thing, which
is rampant.
Yeah.
And a lot of these people are great, good people, but it is a little bit of selfishness too. That I don't want to harm my children or protect my neighbors.
Yeah. I think there's a, and they may be harming their children, so that's the truth. I'm a physician 14 years, this is the last question. Physician 14 years out and do not remember any training in talking to patients about end-of-life care. I'm an emergency room trained physician, have had this conversation so often at times of emergency instead of when it could have been a time when it was earlier and made more options available. That said, it's often a discussion of do not resuscitate, which is interrupted as do nothing, or is interpreted as do nothing, versus what it is intended to not do aggressive care. I would encourage training while in medical school and continued competency training in this, also to include palliative care options in these discussions. Thank you, Scott. My question to both of you is, did you have training in end-of-life, talking with people about end-of-life care and this kind of questions?
As a medical student, we had a fair amount, it felt like.
So it's changed.
Yeah, it's changed. They're making it part of the curriculum. Is it enough or not? You know, part of it you just have to, the practice of medicine and learn as you go. I
think the most important issue that I shared with the Parkinson's group today about advanced directive, and I think is that it really not that important of a legal document as it is a communication tool with your family. Talk to them about how you would, if you lost your ability to know who your family members were, what would you want or not want? You agree with me on that?
Yep.
Thank you for joining us on our website. We appreciate all of your questions and the opportunity to answer them. And until next time, stay healthy out there, people.